All right, we'll go ahead and get started. Thank you, everybody, for joining and welcome. We have a full amount of content to share and to dialogue with you all on, so we want to make sure that we jump right in. So, my name is Aaron Clifford. I'm the Senior Vice President of Marketing at Binary Fountain. I am dialing in from Nashville today. And Binary Fountain, in case you don't know, we are a customer experience platform. So we help manage your brand's reputation, the listings management. We have a number of digital tools that help enable your brand to connect to your customers and to your patients and provide the most optimal experience. So I'm excited that you all joined. I always enjoy doing these webinars and really appreciate it. So, you might be thinking, these are pretty normal times, in the healthcare industry. So what do we need to really talk about? No, that's not the case. No, this is a pretty, all of the words that are used to describe the unprecedented, unusual, and just, whoa, 2020 year can be used here, right? Fill in the blank. But, it's interesting. We've been doing this survey, this consumer survey. We poll over 1,000 individuals, and we work with one poll, and we've been doing this for 4 years. And so it's interesting to see the results and maybe even see how some of the results have been painted by the events of this year. So consumer behavior, as you guys know, and I'm sure you're experiencing, it is changing. And so the survey is basically to reflect, and the results of this is to reflect of what exactly is changing and maybe put some words and verbiage and help you all to communicate to your senior leaders and of initiatives that you may need to do and provide some insights that might be useful in building justification for various programs and projects. So we're going to share a little bit in how patients and consumers are engaging with their healthcare providers and opportunities to improve the patient experience. So we're going to walk through the findings of our survey about how consumers are finding doctors online, their main frustrations with booking appointments, where they leave reviews, and all kinds of other data nuggets that might be helpful in building your case and that you all might find interesting. To offer some of this wisdom, along with the survey results, is Stewart. I'm joined with Stewart, the CEO of the integrated marketing firm Healthcare Success. Stewart, do you want to introduce yourself?
Yeah, I'd love to. And thank you, Aaron. It's an honor to be here with joining you and your team to put this on today. So for those of you who do not know me and haven't seen me before, I'm CEO of Healthcare Success. We are, as Aaron alluded to, a integrated agency, but I would even really refer to it as a brand performance agency. So our goal, really, most of our engagements are designed beyond branding, it's to deliver results. So a lot of times we're building service lines, whether for multi-location practices, health systems, hospitals, other kinds of healthcare entities, but usually we're driving results in some way, right? Very tangible results. So in that work then, I work with hospital executives and CEOs and doctors and patients. And so I feel like I've been doing this for over 20 years. So I feel like I've got some, sort of, I guess, context I'm hoping to bring today and maybe some insights to the data to help inform what the data means. So excited to do that. Before I get started, there's something I think is really important to acknowledge that this data, from the big picture, before we dive into all the specifics, I think the first thing that I noted as I was going through the data is that it's aptly named, right? So it talks about the healthcare consumer versus patients. And I think that's one of the biggest takeaways. And I think as you listen to us go into the details here in a few minutes, think about how patients have really become self-directed healthcare consumers. I think that's really, really important because one of the things that it used to be that patients were very subservient. I follow the advice of my doctor or family, and that's really the end of it. Now patients are saying, I'm the decision maker here, thank you very much. And you'll see that as we get into this data. So it's not just trying to talk about healthcare consumerism, it's real. And for those of you that are working with your board or your executive team or leading doctors or whomever to help them understand this new mindset of it's all about healthcare consumerism. And it's something I speak to a lot. And the other thing is, as we get into this, the patient journey is incredibly complex and incredibly highly fragmented. So Aaron was referring to the sort of joke about dealing with COVID today and the challenges there. The other little challenge you might have to really figure out what to do with is you kind of need to be everywhere. So that's not a problem. Fortunately, there are ways of doing this, and Binary Fountain is a great provider, and so there's ways of helping you leverage your time, because really it is an omnipresent world out there. So yeah, excited to get into the details.
Well, thank you. I enjoy presenting with you, Stuart. And if you guys are looking at the slide, there is a little pre-COVID hair for Stuart, obviously not me, and a post-COVID beard. So, you can't always trust those profile pictures
Yeah,
of what's reality, right? I mean, we know that from physician profiles and their pictures, but
it's a whole
could
new
be
world.
true of these webinars. But again, thank you for joining. Before we get in, for you agenda folks, because I know that there's folks that want to know what's on the agenda and what are we going to talk about. So first, we're going to look at how consumers are looking for doctors and what matters to them during the search process. Then we're going to talk about the patient engagement channels and top frustrations with the online appointment booking process. Then we'll dive into where patients are leaving physician reviews and what they're saying in those reviews. During Q&A, that's the final section. We encourage you to post your questions as the webinar and as we're presenting, and we'll get to those questions. We may dive into those before if we sneak over there to the QA, a little button in Zoom, but please ask those questions and we'll get to those. And if we run out of time, feel free to reach out and there'll be contact information there too. Would be love to talk to you more. So let's get started with some of the major 4-year takeaways that we've uncovered this year. The first question that we asked, and this question has been on all 4 years. As time goes by, we've added some other questions and gotten some more insight, but this one's been on there all 4 years. And it's, what sources do you use to look for a physician? No surprise here that word of mouth with your family and friends is still at the top of the list. However, that has slowly been declining the last 4 years. People turning to digital and online sources. What I find really interesting, and this will be a little bit of a theme that I'll touch on, is that 53% said the provider or hospital website. And I know that there's been so many initiatives that you all have done in the industry that has been undertaken to really build the local hospital brand and maybe even a national brand. And that is reflective in the survey that's paying off. That people are going to the hospital website and trusting, oh, you're a trusted source, I'm going to go look for a provider there. Of course, and that is even above the insurance provider website. And they may be looking for, whether or not that provider takes the insurance of the consumer, but it's still going to that hospital and provider. It's still trusted. Of course, the insurance provider, people want to know, are you on my plan or not? And where can I go? Who's on, who's off? And then the online search engine, of course, Google, you guys know this, I'm sure, from your analytics on your own websites, but that is still a major. And then you have social media sites and voice search. Voice search is an interesting one because we've seen a steady climb of that. And what's interesting is the efforts that you put in your online search listings and those third-party directories definitely help the voice search as far as from an accuracy standpoint. But I think people becoming more comfortable with Siri and with Google Home and Alexa, all of those devices, I think we're seeing reflective there. Stuart, what are your thoughts on this one?
Yeah, excuse me. It's really interesting. I think that, first of all, as you mentioned a minute ago, like friends and family are still number one. But if you see the ebook that Binary Fountain is putting together, it has more detail because we kept a big picture for the webinar today. What's astonishing is the importance of everything else has grown so much over just a few years. So it's really now neck and neck, those top 5. And I will expect to see that more and more over time. So that's really again, I mentioned earlier at the opening that this is an omnipresent world, and it is. People are looking online for search engines. They're reviewing rating sites and review sites. They're looking at the hospital website. Healthcare is the ultimate high involvement purchase decision, right? Like, it's not like buying Special K at the grocery store or granola. That's low risk choice, right? When you're talking about serious disease or surgery or those kinds of things, it's high involvement. So naturally, people will tend to use the resources that are available to them. So as they become more and more accustomed to using these resources, really for anything else, right? Online for everything, shopping, while they're in Best Buy, they actually go online to research other options. So I think the trend is obvious where that's going to go. And I guess the other comment I'd make on this before we go a little deeper is that voice search is up a lot. That actually surprised me a little, that it's that high, because again, when you get these high involvement decisions, it's unique. A lot of people want a little bit more research available. However, our search team at our agency, both on the paid and organic, for like primary care, do things like Doctor Near Me. And so those kinds of searches do add up. And so you can see all of it's important. Sorry. Welcome to 2021. You have to be everywhere.
Right, right. Great, thank you. Well, the next question is, how many reviews are needed before you make a choice on the physician? And that number came in at 9. So consumers read an average of 9 reviews before choosing a doctor. Which is interesting about this is back in 2010, 2011, when I started doing a lot more, my previous company with physicians, there were only majority of providers did not have reviews, and those that did had 2 to 10, anywhere in that. They didn't have all that many. But I think as time and adoption has come, people getting more, there's more options to share, but then also becoming more comfortable with sharing online and providing a review. Those have climbed, and so it's interesting, to have, doing an inventory of looking, well, what are the number of reviews that our providers have on third-party sites, and having that metric down, kind of understanding where you stand there. And then if you have a transparency program and where you're listing the reviews and comments and ratings on your own site, seeing how many you have there. For our customers that have a transparency solution, we typically recommend not posting any reviews until there's 30. So there's a wide range and variety there. But it's really important to do that inventory and to realize that consumers are reading these reviews, and if it's an average of 9, you want to make sure that they are healthy. And there's a big number. Stewart, did you have any thoughts on this one?
Yeah, I've got a lot actually on this one. It's funny you mentioned years ago, and I think back when I first started our firm in 2006, and from the beginning with our agency, we really focused a lot on being online for terms like healthcare marketing and anything to do with marketing and healthcare, and still have a lot of SEO built into our site. So back then, in particular, though, we were everywhere people looked. And so I got a lot of journalists called me right when the doctor reviews began, right around that time period or a year or two later, because up until then, nobody had reviewed doctors online. And doctors, in particular, just hated this idea. And, I remember an orthopedic surgeon once saying, look, I've been treating patients, thousands of patients over the years, and my entire career is summed up right here by one crappy review. By somebody who doesn't even know what I did for them. So they really hated it, and this was news back in the day. And unfortunately, my comment was, sorry guys, but we're gonna have to get over it, because number one, patients love reviews with anything else, and that's going to increase. And by the way, Google loves reviews. So it's funny, it took a long time. A number of years ago, I interviewed University of Utah Health on our podcast. Back when they started putting reviews on their website. And again, I was admiring them because, boy, that must have been fun trying to convince the internal doctors to do that. But now we've come to where we are today. And so again, while the providers have gotten better and the hospitals have gotten better at reviews, and there are platforms like yours, Aaron, to make this easier to scale, you can see 9 reviews is a lot. And I find that even today, with all these options out there, there's still a lot of hospitals and a lot of big groups and obviously solos that have not done a good job of maintaining their reviews and not done a good job of owning their reviews and doing what they can to, create systems to get robust reviews and improve their patient experience. And you could do lots and lots of discussion on this. But I just wanted to illustrate that it is really important. And again, this is not going away, it's increasing. And then one final comment I want to make. There's another question in the raw data that I thought was really revealing, and I've talked about this a number of times in my podcast and on other topics, but essentially the question confirms something I've seen from like Prescaney and others, that over 2/3 of patients are checking out reviews even after they've been referred by a doctor. So think about that. That's really important. I want to say that again. over 2/3 of people, even after they're being referred by their primary care doctor, will check out reviews and the provider websites. That's huge. So, again, it used to be in the day where the patient is a patient. They sort of are a ping pong ball bouncing around the healthcare system. I mentioned earlier self-directed, and that's just to me, it's a big, big takeaway of this little slide here.
Great insight. And there was one question, I just want to address this one. Saw it in the comments. What's more important, first-party reviews or third-party reviews, or both? And so what I'll say is in this survey, when going through it, it may be self-revealing, just in terms of how consumers are looking and where they're looking to choose a doctor. And so I would say both right now, but I think some of that will be put into place as we're answering some of the questions and looking at the survey results. So, most important factors for choosing a doctor is insurance coverage is still number one, and this has been that way for a while in our results. So it's definitely, the cost of healthcare. People are looking at their deductibles and looking at how much certain providers are going to cost. As an urgent care, is it less expensive than going to a primary care or going to a nurse practitioner? How are all those things, and what does my insurance cover? I think still really important aspect in choosing a doctor. Location, that convenience factor, that consumer, the title of this webinar, consumer, or the consumer insights. The consumer, what's convenient for me? What is going to work out? And it may be location near work, near your kid's school, your house, of course, but location's still really important. You want to make sure it's not consumers. You and I, we don't want to go somewhere that's way out of the way. It may inhibit our own health by not going there because it's too inconvenient. And then family, friends, recommendations. What's wild is online ratings and reviews are not too far behind that from the family and friends recommendations. In some demographics, I'd say the younger demographics, they actually trust the online reviews more. And as far as they'll take their cues from the online reviews more than they will their family or their friends. But again, this hospital affiliation, and this is going to be a theme, like I said, this is another one in that theme of that brand affiliation that your doctor has with the hospital. It matters a lot, and that cannot be de-emphasized. So just want to highlight a couple of those items. Stewart, I know you have a few thoughts on this one as well.
Yeah, starting off with what we just described, because Aaron and I were talking offline about the importance of the hospital affiliation, which translates really into their brand, right? How important is that brand? And, again, I've had lots of discussions on this on podcast webinars in the past, but the hospital brands are, number one, don't change very easily. A lot of times the hospital is part of the community and it's part of the fabric, and hospitals have reputations. So it's not going to change without you really having a concerted branding effort to build that brand. And one of the things I think about at this stage is, as we think about that particular issue, one of our clients, longest clients, worked for 3 years, love them, are kind of a safety net hospital, 500 beds-ish, and they serve a lot of Medicaid. And we've worked with them on a very tactical basis over the years. And because they're really focused on service lines, and right now we're working with them, and it's really time for rebrand, and hope they'll take advantage of that, because it's kind of like by improving a brand of a hospital can rise, the tide that rises all ships. So yes, you can do all these individual service line marketing efforts, but the brand is really important. You can see how important that is. I can think of another hospital we work with that doesn't have a stellar reputation, and it actually hurts the results when the hospital name is mentioned. So it's a big impact. Don't underestimate that. Another couple of things to think about. The insurance coverage, as Aaron said, is always critical. And my point there is that for many, many people, it's kind of a binary option. The search begins, everybody, if you imagine two universes, universe one is within my coverage, universe two is not. Everybody, it's really kind of bizarre. I'm sitting here playing with my insurance card for some reason while I'm talking about this. It's a coincidence. But most people won't even consider somebody outside of their insurance. So what that means then, though, you have to be very cognizant on the consumer experience when you go to your hospital website or your practice website. Make it easy for them to find that. For many of our clients, not all of our clients we do this, but for a lot of them, we want to make sure that insurance coverage is right there where people want to see it. And that's a strategic decision in any event. Make it easy for them. Number two, location, likewise, really, really, really important. And so, it's again, the doctors in the hospital may be thinking about it's my board certification, my fellowship training, my time at Yale or whatever, and like insurance coverage and location at the beginning of the discussion. Now, I'm not diminishing the importance of that other stuff. I'm just saying it's kind of like they do their easy stuff first, and then from there they look within that universe of how they're going to choose. So make that easy for them to find. And then finally, that last one there, or that second one, location. For those of you that are involved at the strategic level at the hospital, because a lot of hospitals and health systems now are building ambulatory clinics into the community so they can get patients, they want to be where the patients are. And even in these days of telehealth, location really matters. So not just from a make it easy for people to find the website matters, but from a much bigger perspective of where do you want to be, it's where the patients are.
Great. And I just say on the 35% online ratings and reviews, and this is more in the ebook, but that has doubled since 2017, which is pretty significant as well, just seeing that move up. The other one's pretty stable as well. All right, so the next question that we asked is, what platforms do you use to help you choose a doctor? And so, again, touching on that theme, hospital facility website. So important that you have and you're investing your time and resources into your website. And I know many of you are, from wanting to rank on certain procedures or certain conditions, and that's really good. Wanting to build tools like book an appointment. They're coming, they're looking at your directories and making sure that that experience is amazing. As your first party site, your hospital, your clinic site, definitely needs to be on par with third-party experiences. And I know in the last number of years, there's been a big effort in that. Many of you on this call and many in the industry have been working towards that. And it's never where you'll just arrive. It's always an investment. It's always looking and measuring and seeing what can we do better and what experiences are our consumers having elsewhere and how do we mimic that so they're familiar and it feels comfortable and it's delightful to them on our own site. So that is pretty major, and I think that it's something that if I'm in your guys' shoes, I'm using that stat to get further investment into your own website. You can't emphasize that enough. Also, in looking at how are people responding to your portals and once they log in, that authenticated experience, is that delightful? Is that doing a good job? Of course, Google is right there close behind. So from this perspective, and then on the rest of the review sites and social media sites, but making sure that it's reflective of your brand. And when you have, this goes a lot into content strategy. So not just the platforms that are used to help people choose a doctor, but this goes a lot into the content plan and strategy that you have in terms of, don't forget about the third-party sites. If there are new services, if there are questions that you can answer on those third-party sites and they give you that opportunity, make sure that you're updating those as well. I think that it's extremely important. If you see and you're investing all these resources into your first-party site, which is important, but not neglecting those third-party, because those are really close behind that 37% number. Stewart, I know we talked about this. What thoughts you have on this?
Sure. Well, first of all, what was intriguing, and when you see the data in the ebook, it goes even deeper. So this stopped at Twitter, but there's a plethora of websites that people have used to find a doctor. So it's not just these six, just for the sake of what's the most important of the top six here, but there's probably dozens, certainly a lot. So that's number one. Number two, it's again a complex mix of owned. You can own your website, you can earn social media points, pay to play, and there's a combination of all those things that matter, right? And so our agency, Google up there is absolutely critical, and our agency does a lot with, certainly organic and paid search, and we do tons with paid social and programmatic and WebMD's a partner, and we work with all these different folks every day, and they're all important, right? So that's the first thing, and just recognize there's a lot of them. And then a couple other quick insights on this. Number one is that another question that was related to this is the raw data showed that 70% of patients said that online reviews are influential in their decision about doctors, which is different, right? This is about finding them in the first place, but 73% said they matter. That's really important. So keep that in mind. So the things that Binary Fountain does or helps do on the organic side really matter on that. Just another couple of quick commentaries too. Included in the data on this slide, I mentioned there were many different players. Others like Yelp and US News and World Report were there. And what was interesting about Yelp is it seems to have a disproportionate share of attention from many doctors for sure, and maybe because it was one of the first. And certainly a lot of people have told me they're not excited about the way Yelp handles reviews, and they feel like it's being difficult to balance out the reviews they feedback. And for whatever reason, that happens a lot. A lot of people tell me about that. So the thing is, it's interesting is though Yelp seems to be decreasing in importance to consumers. It was less important. And I know a lot of hospitals and practices care a lot about Yelp, but it has decreased in importance. Also, US News will Report is certainly important from a doctor-to-doctor standpoint. Hospitals are very proud of their reviews. From the consumer point, it was on the map, but it wasn't, again, a critical factor. And finally, maybe the last comment on this is Facebook. The death of the announcement of the death of Facebook is premature. Facebook is a very powerful entity out there, and there's a stereotype, even among marketers who probably should know better, just assume that, well, Facebook has just become moms and older mothers and grandmothers, and it's like, well, actually millennials are big Facebook users, and Facebook is the one, and Facebook and then its relative, because it's on Instagram as well. That combination is really, really important for a whole bunch of reasons beyond the scope of this meeting, or this webinar. So they are all important, and I think you really need to have strategies for each of these, especially the major ones. Like, what are you going to do?
Yeah, good. There was a question that came in, and I just want to address it. There's two of them related to the number of participants in the poll. So we worked with one polling and survey organization, and they had reached out to 1,000 individuals who had seen a physician and did a search for in the last year. So there's a number of criteria that they go through to pre-qualify those. So just to answer that one. And then someone made a comment, and I meant to say it, but Twitter was a surprise on here. And it was for me as well. I was really like, wow, that's interesting. Why Twitter? And so there's some hypothesis that I have, I don't know, the exact, the science of how are people actually using Twitter, but I do think that there is a little bit tied into that hospital and facility web brand and website, and really the facility and hospital brand that plays into it. I do think, depending on the search, if you're searching for the branded term of a physician and provider name, oftentimes, depending on the specialty of that provider, they will show up in Twitter. So that's my only deduction. I was trying to piece that together, but really interesting. And it may be questions, people asking if they are active on Twitter, if they're asking their followers and their community online, who do you use and who do you recommend, which would be somewhat of a family friend recommendation, but also community, but also going to Twitter. So just that's my best guess, but thank you for pointing that out. It was a head scratcher for me too, because it's not like Twitter has a directory, right?
Yeah, I think it's hard when people are answering a survey when they're using to find a doctor, if it's meaning that literally or it's being influenced is probably part of that. And the other thing too is the big social networks, right? Facebook, Instagram, Twitter, LinkedIn are kind of like the big four that people are interacting with, and the use cases are very different. Obviously, I'm involved in all of those because it's my job for one, and I'm a consumer as well. But Facebook is a different environment than Instagram. Instagram is, of course, super visual, and people use it in a certain way. And obviously, there's others too, right? Snapchat and lots of different things going on right now. But the Facebook is more it's more community feeling. Twitter can be either political or thought leadership, and LinkedIn is very different as well. So people use these all differently, and it's funny. A lot of people, for example, Twitter. They're not on Twitter, and so it's hard to understand these platforms unless you use it. But it is a head scratcher, but I think it may have been more to interpret that they're being influenced. we weren't there to talk to them. So
Right. Good point. All right. This next section is, and that we asked, have to deal with communication with the provider, booking appointments, and top frustrations. So questions around these topics. So the first one is from a preferred method of receiving information from your provider. What was interesting is phone call is still at the top of the list. And we didn't go into detail about appointment reminders and health diagnosis and some of those sub things. It's just receiving information from your provider. And phone was still the primary and the highest, rated the highest among those that responded. Email close behind there, and then there's text messages. So there's, obviously there's a number of different tools that you employ depending on what you're wanting to communicate and to your current population, patient population, and then also to consumers. And so it's really having a plan, and I know most of you do, of what you are communicating. I think at a hospital and system level, really comes in, and I know that there are discussions in many systems happening between the patient experience departments and the marketing as far as touch points and who's communicating what and how often are we communicating. I think those between a phone call and email and even text, from the opt-in, opt-out, the details of that, very important to have a plan there. But still not neglecting, and we have a customer who used text messages to communicate to their customers about that they had a vaccine. There was a pediatric group that was announcing that they had a particular vaccine available for pediatricians. I think it was MMR. Like, this is, have you had your child, vaccinated? And they sent out a text message, and that was the way they communicated. And they had a pretty good response rate as far as appointments being made and their children receiving that vaccine. So that, interesting use case there. But of course, having these things, and there's more. In the survey there are more options. Stewart, what was your take on this one?
yeah, very interesting in a number of ways. First of all, phone calls being number one. From a system provider, if you've got a large multi-location practice or hospital health system, phone calls are expensive, quality control is hard. You got to figure out all these logistics and figure out it costs money to have all these people. We'd love them to drive them to the website and just do everything there. However, it's healthcare, and certainly healthcare has a disproportionate number of seniors who are very comfortable on the phone. So it's not surprising to me that phone calls are very, very important still. And that will change over time and become less and less important. But that's, number one. It's going to be a while before that happens. A little bit of good news on that. In previous webinars this year, I've talked a lot about COVID and recovering from COVID. There's some evidence to show that patients not only prefer to receive information phone calls, that you can use the phone to get people back in. So there's a lot of, even still today, of course, with COVID, it's up and down daily at every market. If you know a hospital in a given market, you know that hospital, right? It's like there could be no COVID patients, it could be overwhelmed. But the fear of coming in for elective procedures is high. What's interesting is patients have indicated that they are willing to come in if the hospital provider called them. So just keep that in mind. The phone is super powerful, and that of course requires logistics and training and time. But if you're struggling with your ancillary services or elective services, phone calls can help. It's often widely underestimated. I think email is, again, very different in my experience at the hospital and provider levels both. It's underutilized. Some hospitals are really, really good at it. They have databases and they know what patients are interested in, and they model and do all kinds of things to get really relevant emails. Others, don't have any patient email addresses, don't have figured out HIPAA, haven't figured out the most basic stuff, and do nothing. So you're leaving a lot of opportunity on the table if you don't have a really fully robust email program thought through and implemented. Text is awesome for appointments. We talk all the time about how it's immediate, and think about it's also intrusive. So you want to use text carefully, but clearly for things like appointments that makes sense. And finally, the last point on this is Aaron we talk a lot about the importance of social media, but the facility website, again, I think people may underestimate the importance of that, and it's again a big factor. And interestingly enough, Aaron, my last comment on this, actually is, we didn't show it on this particular slide, but if you go to, even to the deeper source data, direct mail was right behind social media. So nobody likes direct mail, and if you're, haven't been around very long in marketing, it's like, oh, direct mail, what's that? A lot of people still like old-fashioned, expensive, hard to scale direct mail, but there's even a place for that.
Yeah, it's been a while since I've received a direct mail from my provider, but I'll be looking for
You,
it.
you know what's funny about that, Aaron? I got to say this to the side since you brought that up. I'm the CEO of a company, and I'm on all kinds of lists. You would think I get, direct mail every day, and I get direct mail exceedingly rarely. It's like that's why it still works, because it's so
Mhm.
intrusive, it's so inexpensive. Um, by to go directly at me, whereas I get hundreds of emails a day, hundreds. And nobody talks to me, thank you very much. They all go through my assistant. I won't take a call or a meeting or anything without it going through my assistant, without an email introduction. It just doesn't happen. I don't have to pick up. But, this direct mail comes in, it's like so uncommon, I'll look at it.
Yeah,
It's,
right. Yeah, I had a colleague or a friend in another health system said that her CEO came up to her and handed her a little postcard, and it was about a conference, and said, "You should check out this conference." And that was last
yeah,
year,
exactly.
and it was kind of interesting because
And
the direct
a
mail.
couple times there, and we do a seminar a couple times a year in Las Vegas, and we invite hospitals and providers to come to that. And for all the internet, for all the speaking, for all the emails and subscribers, 80% come from the direct mail. It's just bizarre.
That's wild. Yeah, so still has a place. All right, going to the next one. We asked individuals do you where are you booking the appointments? And here comes phone call number one again. And I think part of this is, the online booking appointment, whether the providers have one or they don't. Often when they do have one, users seem to feel like and patients, consumers feel like it's inflexible, and they might be able to get a better appointment, or more somebody to work with them when calling. And so I think as we see the maturation and the advancement of online booking tools become better, and I think each year I'm seeing improvements where there is more flexibility and options, that we'll see phone calls drop. This has dropped the last 4 years, so I think there's a little bit of that happening. Again, emphasizing the facility website, your tools that you have available. I would say, there's a great opportunity there, whether you're using a third-party tool and it's integrated into your own branded site. You definitely want that traffic. You don't want to leave the booking of your appointments from the consumer to the third-party sites. If it's working for you and that's a channel, that's great. But you definitely want to be able to facilitate that in the most efficient manner on your own site. So again, really interesting here from booking an in-person appointment being a phone call still.
Yep. So I would just add to that. It's interesting because that surprises me. It's clearly, the data shows that the older the patient is, the more likely they are to really like the phone call, and that's broken down in some of the data. But keep in mind, don't stereotype. So for example, for me, I'm sort of in the middle-ish there, but to me, to get the idea of getting on a phone to book an appointment drives me insane. Like, I just don't want to do it. And I'm busy. And I remember once with my optometrist, I emailed them and said, okay, you don't have book online. Can you please here's your dates. Can you please give me one? I'll book that way. And they emailed me back saying, can you please just call us? And my answer was like, no. So those that want to be able to book online, really want to book online. I'm busy. I don't even think about this stuff until after hours. I never think about booking appointments during the day. And so I think that even though phone calls are important, I would really strongly urge you to think about making that facility website as patient friendly, embrace online scheduling, make it easy for the patient, because this will change. If you look at some of the other data that's changed predictably, the influence of social media and rating sites, this one I think is going to change over the next few years. We'll see. We'll talk about this in a couple of
Right.
years.
All right. We'll have to measure the
It's going to change.
results. Agreed. All right. The next question we asked was, how do you usually book telehealth appointments? So obviously this year, with telehealth getting a lot of coverage and people utilizing it a lot more, thought we would ask. And so phone call still atop of the list there, not as many as an in-person. facility website, and the patient insurance portal being 11%. So again, a lot of what we talked about in the previous slide and the points apply to this one as well. But I did think it was interesting just in terms of, that patient insurance portal. I think insurance have been pushing telehealth appointments a lot more. So no surprise that it's there on the list and a little higher. But Stuart, anything on
Yeah,
telehealth
just
appointments?
quickly, I think on this one, it might be a lot of those phone calls might have been uninitiated to telehealth people that were calling for a COVID appointment and switch. Because it is ironic. I
Sure.
mean, it's telehealth, and then you want to go make a phone call to do telehealth.
Mm.
But I think it's, again, as consumers get more educated, more comfortable with telehealth, that number is going to explode. It's absolutely predictable. So yeah, we'll see more of that.
Yeah. All right. And then the next one, the biggest frustration when booking an appointment online. This is kind of all over the map, and you see similar percentages, but incorrect and missing contact information being number one, services not listed, number two, and then not enough physician information, number three. I think, as there's been initiatives of, beefing up the provider profile and bio. I'm really happy that that's just not enough information on the physician is not number one. So that means you guys are doing a lot of great work of profiling your physicians. Still more work to do there, but I've a number of health systems investing in video and interviewing the physicians and content. It seems like that can never be enough for consumers, and very important for them to have information to choose their physician. But then the incorrect missing contact information, I think a lot of this has to do with whether it's phone calls or directions, some of those things and challenges that come up with listings management. Here, it may be where they're practicing and what offices they're going to be at. So investing in that's a first party platform problem, and you have managed data, physician data, know this. That's a first party and a third party issue, especially at the health system where you're dealing with affiliates and employed docs, and all of that data you have to manage. Really, really tough. I thought it was interesting to know not enough reviews, being 10% at the same level as incorrect hours and no insurance information. So that's another one that kind of is within the theme of reading the 9 reviews before choosing a doctor, kind of within that same theme. Stuart, any insights on this one?
Just a comment broadly is, people have higher expectations of healthcare today than they ever have. They used to be able to put up with just about anything. It's my doctor's office shrug. It's not the case anymore. So anything that frustrates a patient is bad. Fix it.
Yeah.
That was
All right. That's simple enough. All right, in the next section, leaving reviews, where and why. So where are consumers leaving reviews? So going to the first one, what are they saying in these reviews? Some of the most frustrating aspects, and we asked them, what are the most frustrating factors when visiting a doctor? Wait time, no surprise. We are in America. We want things fast. We want it now. We don't want to wait. We don't have time to wait. So 32% leading the charge by far margin than over cost, exam results, scheduling the appointment. So that wait time, it was interesting just in terms of the expectations that we have for being seen, and this could vary. We didn't go into detail about is it between 0 minutes and 10 and 20. This is just wait time becomes the most frustrating factor when dealing. So important, there are, and I know this has been an issue that health systems and physicians have tried to solve and provide. They started early on with providing magazines, right? And these old outdated copies. Luckily, we have these, phones now that we can kind of pass time on, but, still a frustration point.
Yeah, and I would just add to that, Aaron, the wait time data, if you look back to 2017, has actually improved. So it's still the frustration level, I don't remember what the number was, but it was something like closer to 50%. And so with that, I think the insight there is that some hospitals, health systems, and doctors have figured this out. This is important and are looking from a patient experience consumer point of view and figuring out how they can build a system around the patient's need versus building a system around their own needs. Very different way of thinking. And so the major point here is this is a frustration. So this to me is a big red sign saying opportunity. because if you can resolve this big frustration, it's a competitive advantage. So if you want to be more in tune with what consumers want today, clearly a lot of them just presume they're going to have to wait. It's like they've never experienced it. So when you pleasantly surprise them that they don't have waits, they'll remember it, they'll comment on it. It's a huge opportunity for a way, instead of buying a new wing for the hospital, something simple like wait time can really help.
Yeah, and there's earlier when I'm mentioning, that 85% of consumers find online physician reviews reliable. Some of these frustrations and themes may show up in your reviews. So, looking at this may not be for everybody. You may have wait time dialed down, but there's some other frustrations that are revealed in the comments and or in patient surveys. So important for you to do your own and have your own KPIs around this. This was just from the 1,000 that were surveyed.
And just quick, because I know we're running, we've
Yeah.
got close on time, but a couple of years ago, I talked to the people over at Cleveland Clinic. This wait time is undefined, right? It could be wait time to get in, it could be wait time to once you get in on the phone, or there's a lot of different ways to have wait time. But they had a hospital or system-wide initiative, same-day appointments are available. And that's just an amazing thing. But that, again, is that consumer mindset of getting patients in across the board. And it's a long story. If you're interested, send me an email. I'll give you the link to the podcast. But just to think about a system like Cleveland Clinic, making same-day appointment can. Same-day appointments available is amazing. But that's that consumer mindset again. It's a competitive advantage.
Absolutely. All right, the next one was factors when rating or evaluating a doctor. And so these were, when looking at what was most important from a standpoint of what's important to you for your doctor and what are you evaluating them on. Friendly and caring attitude, number one, that has stuck there. And then thoroughness of exam. So that human connection. We are humans. We want to connect. We want to felt cared for. That's still number one. And so important to share this with your physicians. They know this, I'm sure, but it's a good reminder just to have this. Maybe not just like, hey, Dr. Smith, friendly and caring attitude is important. Fix your attitude. Nothing like that. But in sharing some of these results, I think that it makes a little kindness and all the patient experience initiatives you're probably have in place and are pursuing. That friendly and caring attitude definitely pays off.
And quickly here, the soft stuff really matters to both men and women, a little bit more towards women. The guys that responded to this favored this by a little bit higher percentage on things like thoroughness of examination and reputation of provider, which didn't make the cut on the slide here. But soft stuff matters to everybody, and the communication, human stuff. This is becoming an increasing awareness. Interestingly, and I think that we looked at the data from the demographic side, older patients cared even more about the soft stuff than younger folks. So it's just, it matters.
Yeah, definitely. All right, and then the last question we're sharing here on the webinar is what online platforms did you use to share your patient experience? So nearly in the survey, 82% of consumers said that they had shared some healthcare experience online. That could have been to their own Facebook friends. That could have been in a review. Could have been on Twitter, Instagram. But here's the breakdown. So the 18 to 23-year-olds shared on Twitter, Instagram, and WebMD, which was interesting. And also the 40 to 55-year-old demographic shared on WebMD as well. You kind of see Twitter being the first two age demographics. And then the last one, Facebook, the 56 plus, was kind of the exclusive. That was the highest. I mean, they also shared on some other platforms, but that was the highest number and percentage that had shared an experience online. So really important just to understand where your patients are sharing and being there, monitoring it, making sure that you have a presence there. Stewart, was there any surprise here?
Yeah, not really. And what's interesting is I alluded to earlier the importance of Facebook. And again, the depth of Facebook being greatly diminished. These numbers kind of break down with Gen Z there at the bottom, or the youngest rather, millennials 24 to 39, Gen X 40 to 55, and baby boomers. And so if you look at it that way, not surprising to me at all that, again, Facebook, everybody's talking about the death of Facebook. Well, yeah, Gen Z hasn't embraced it as much, right? Because they were really young when their parents were on Facebook, so they never got there. They really focused on Instagram as like number one there. But everybody else is on Facebook a lot, so Facebook matters. And For our clients, we're promoting with paid social, Facebook and Instagram are at the heart of it both, because they're all very, very important. Obviously, Google's important too. That's a huge one across the board. So those, it really matters. I love this slide because it's such an easy encapsulation. We're talking over offline about how much we all like this particular slide, just because it encapsulates so much. I think I'll borrow this slide for some of my own presentations, you guys. It's a really easy way to communicate something that's relatively easy, but people get lost. They really feel they forget how important these are, and they make a lot of assumptions that are not necessarily accurate.
Yeah, good point. So going into Q&A session, we have one that's related to these online platforms. Someone saying they would love to see the national stats on Yelp, and there are. So I would agree that it's falling off in importance, but there's some individuals that still love Yelp, and I think that it is a market by market, and looking at some markets have a lot more activity in Yelp, and so you can't dismiss it and just like it's not important maybe on a national scale, but locally, if you're in Austin and you're in some of the southern states or where Yelp had a foothold early on, where there's a lot of users and a lot of utilization, you can't ignore Yelp. And so that is a location by location decision, so you can't dismiss them all. This was a national survey, so we'll look to see and maybe include, try to get some of that data to share more in the future on platform specific and demographics, or geographics, I should say, areas.
Yeah, I just add to that is like it also depends on the specialty. The more consumer direct, the more people would think to use Yelp.
Yeah.
Like dentists or something like that is probably more Yelp specific. So that's again, it is a case-by-case basis.
Yeah, so related to this one, Yelp, there's a question, this would be for you, Stewart. Yelp has been pressing for them to invest in an advertising package for a group of pediatric offices. What would you recommend there? Is it worth putting it in, or is it a location by location basis?
It's really hard to say always on this kind of a format because it depends, right, on how are you investing. So I always look at we kind of refer to the investment pyramid similar to the investment pyramid for financial planning, right? So you want to make sure at the very beginning level you at least cover, you have cash, and then you get some mutual funds, and eventually stocks, and then artworks at the top. You can take a risk there on a smaller amount. So assuming you have a broad mix, it's funny, Yelp has been such a mixed bag, and it's really hard to separate the emotion of people dealing with Yelp from the business side of it, but Yelp can work. And so if I have the other bases covered, I would look at it as a test, right? You can test things. That's the beautiful thing about marketing is, you try it for a year, see how it works, and then if it's successful, you do. Keep in mind with Yelp too, when you buy into Yelp, you're buying into their rules. They have almost a religion on the rules of, what you can do and can't do. So keep that in mind as well. But assuming you have a budget, it could be a test. Pediatrics is, remember I mentioned the consumer directness of it. It could be worthwhile, but I would track it and look at ROI.
Yeah, definitely. Good. Question, is Google still considering suppressing star ratings on doctor reviews? And so this is related to first-party sites and transparency. So our customer that have been utilizing transparency last year had a blip in that, and it seemed like some were were not showing up. And I'm talking about the rich snippet and the star ratings that was under a physician's name. Some of those disappeared, some of them stayed. We're seeing a lot of those come back. And so, you have to evaluate, make sure that you're abiding by the rules that Google provides in their content guidelines and their rich snippet guidelines, but we're seeing a lot more of those come back. So good question.
Yeah, you're closer to that than I am,
Yeah.
Aaron. Obviously, so that's what you guys do every day. But remember I mentioned earlier, consumers love reviews. Google loves reviews.
Yeah, definitely.
That's an overriding theme. They tend to favor, responses to reviews, lots of reviews. So I don't make those decisions for them, but that's an interesting observation.
It had a suggestion for managing negative reviews, online reviews. We have a number of resources on binaryfountain.com, ebooks, and also a number of blogs. So I won't go into a lot of detail there, but my overall, let's make sure that you're responding to all reviews as much as you can. Some reviews you don't want to respond to. That's a tickler to look at some of our content on Binary Fountain. Question for you, Stuart, the data supports the need for omni-channel messaging strategy to ensure patients are receiving communications via their preferred channel, not the hospital's preferred channel. So what do you say in that regard with the omni-channel, messaging?
Yeah, that's, we often talk internally about the challenges of being in the hospital marketing department, right? It depends. Like some hospitals, um, marketing is esteemed. It has a seat at the strategic table. It's critical. In other hospitals, nobody understands it. Nobody values it. It can be really, really frustrating in a world where the doctors are in charge and the marketing person is um, just not understood. So I would say in those cases, whether it's you have to deal with doctors or CEOs that aren't really understanding the marketing is, data is the one thing that seems to work, right? It's like this presentation in particular, I think was really great for that. I have found in working with hospitals, CEOs, with boardrooms, and with doctors, and executives, and everybody else, it's like it's really the tiebreaker, at least a lot of times, because otherwise, if it's subjective, their opinion matters more than yours. Sorry, but it does. So at Google, they have a joke. It's like, in God we trust, everybody else bring data. And that's kind of like what I would say here is like, bring data to the extent that you can. Recognize that, this may be a long-term battle internally. Start taking, and then think about the 80-20 rule. So when we talk about, there's 25 different websites to consider, all right, well, let's look at the 80-20 rule. Which ones are the most important? Which ones are the most relevant? So, okay, we gave you a lot of data here. And like, so for example, in some of those slides, Twitter is really, high numbers, but is it really impacting patient decisions as much? Probably not as much as like Google and Facebook. So I would really think through like where can we start, but it is tough. I totally feel your pain. In the hospital marketing department, they're so political, and it's oftentimes marketing is not understood, but data will help. Presentations like this should help you. And then, and if you have more details or questions on that, email me. I'll try to help, because that can be complicated.
Yeah, definitely. Great response there. I had a question on how do you recommend generating reviews, third-party Google reviews for hospitals? So that's a difference between, providers, because it's a little easier to reach out and do some outreach to providers specifically. Some of our clients have had a lot of success in doing emails and asking patients to share their experience at the hospital level online, and had a number of response, and saw their response on our platform. We're like, whoa, what happened? And they had just run a campaign, and they had generated a lot of reviews. So some more on that. Would love to follow up and brainstorm with you, James, on that one. But let's talk for sure. Um, we have more questions, but we are out of time. But we're going to follow up with those outstanding questions. Stewart and I will tag team on those and get back to you. But thank you so much for joining us. We are going to be sending this out, the recording out, to all of you who've joined, and to all the registrants, along with a link to the survey results. So we are really thrilled that you joined. Let us know if you have any questions on the results or on the survey. Stewart, thanks again for joining us. Always
So much
always
fun.
fun.
Thank you for having me.
All right. Thank you, everybody. Have a great day.